who are joining us tonight on Facebook, Instagram, or even on our telephone lines. Listen, I hope that all of you had a wonderful summer, a safe summer, and a healthy summer, but we're back. We're back at our weekly town hall meetings, like I said before, and we are very grateful to be back. We're very grateful because we had a long summer because we all had to embark on keeping ourselves safe, continue to wear those masks, and continue to make sure that when we were out and about, it was more outdoor activities. So with us being back on our regularly Wednesday town hall meetings, we want to just what's going on with the vaccination. You know how important that is. So with tonight, joining us is a gentleman who really doesn't need an introduction. He has been locked solid with the mayor and East Orange Council from really day one, and I really appreciate him. And that's no other than Dr. Mehta, who is the Chief Medical Officer at the East Orange General Hospital. He's going to be here tonight just talking about where we at, where we at with the COVID, where we at folks getting vaccinated, where we at with the booster shots that will be offered. And also we'll give you an update on what we have been doing since we took a little short break during the summer, especially with our mobile clinic that has been fantastic, moving around the city and our different parks and at ShopRite on Central Avenue, at movie nights when we was having, and we continue to do that through Dr. Griffin and our Health and Human Service Department. And we thank her for her staff who really has been on the forefront. We have been really partnering with nonprofit organizations, for-profit organizations, which still, when you hear from Dr. Mehta, we still need to get our numbers up. So look, with that, what I want to do is just give y'all we have confirmed 7,974 positive cases. In the city of East Orange, 325 confirmed, resulting in people passing. In Essex County, there are 24 1,011,758, sorry about that, and 24,745 resulted in deaths. So we're in the millions now in terms of the cases, right? We're out of the hundreds, we're in the millions, as I said earlier. 1,011,000 people have been tested positive for this COVID. Now, we continue to ask everyone to wear those masks, still wearing mine, still got it, making sure you wash those hands and continue to practice social distance and watch where you're going. We talked about that from day one, but we still have to do that. We do and continue to follow our governor who has, lifted so many things, and we're happy about that. But in essence, to all of that, we still have to make sure we stay safe. So with that, I want to go into my conversation with Dr. Mehta and really just dig into the meat and bones of where we at with this city and where we at with this variant, right? So with that, Dr. Mehta, how you doing this evening?
I'm doing very well. Thank you so much, Mayor, for having me again. I was missing you guys.
Dr. Mehta, listen, we're always happy to have you here. We're always happy to make sure that you're a part of helping us deliver our message and making sure that our message is clear and make sure that it's accurate So we just thank you for the partnership. We also, as I said earlier, Dr. Griffin couldn't be here tonight. She'll be with us on some more and future our virtual town hall meeting. But again, we're still going to have a great conversation around this variant. So Dr. Mehta, give us your spiel, man. Tell us where we at, where we need to be, where we're going. Let's talk about our young people. Let's talk about these schools getting vaccinated, our young kids getting vaccinated, and the young people, our young with our community, so our community can embrace the things that we need to embrace and do the things that we need to do so that we can get out of not having these masks on.
Agreed. Is the percentage of vaccination. So just to give you perspective, for New Jersey, about 73% of all New Jerseyans have gotten one dose of the vaccine, and 65% have gotten for having at least one dose, and about 61% who have gotten fully vaccinated. If you go level up the city of East Orange, that number actually dwindles down to just about 53%, if I'm not mistaken. And the reason for that is predominantly vaccine hesitancy, whether it is what people concern about, like, hey, it is too new a vaccine, or people are worried that it is against their religious exemptions, or they have medical issues. But whatever be the reason, the thing is that within the city we have a little bit of some work to do in terms of just communicating it. The vaccine that have been out there in the market are the Pfizer vaccine, which is a 2-dose vaccine, the Moderna, which is a 2-dose vaccine, and the J&J, which is the 1-dose vaccine. Okay. For the Pfizer, they have recommended booster shots for everyone who got Pfizer vaccine initially after 8 months. And the reason for that is that they're seeing cases which are breakthrough. What is a breakthrough case? A breakthrough case is a case in a person who got the vaccine but now got COVID. And what they found is that they did the antibody test. They found that with Pfizer vaccine, you actually did need an extra shot after like 8 months to boost your immunity back up so that you don't contract the virus. So right now, for those who got the Pfizer vaccine more than 8 months ago, the recommendation is just go ahead and get your booster shot. For Moderna, if you got your Moderna dose more than 8 months ago, the criteria is that you have to have some sort of an immunosuppressed condition, meaning that if you have something that lowers your immunity, whether you're taking steroids or whether you have a immune condition where your body doesn't produce any antibodies, or if you have been in a high risk age group, like you're a school teacher or you are exposed in an environment with like a healthcare worker, so they recommend getting a booster. But again, the recommendations with Moderna are still not completely crystal clear. When we talk about vaccines for the younger age group, which I think is a great topic to talk about, the Pfizer vaccine has been approved for kids in the age group of 12 to 18, and I would personally recommend anyone who has a kid in that age group to go ahead and get it. And the reason is not just to prevent the spread in school, but also to prevent the spread of the kid bringing it home, getting the virus home to a grandparent or to a parent who is immunosuppressed. So that being said, the vaccine exists, the vaccine has been tested, we've got tons of real world data now. More than 150 million people in the country have gotten this vaccine. So it's no longer like a vaccine that we don't know about. It is a vaccine that has been around for about 12 months with everyone getting it. And so it's about time to roll up your sleeves and get it. And that's kind of the message that I want to push through today. And that I would love to engage any conversation that comes up.
Right. So Dr. Mehta, listen, and thank you for that information. It's well needed, and although I know that folks been talking about the information that you just provided, what is going on with the booster and where we at, the booster shot? What we need to be doing, where we at, how numbers looking from your perspective, and how can we be of any help in terms of getting that message across to people, how important that the booster shot is to those who have taken either the Moderna, the Pfizer, or the Johnson & Johnson.
Mm-hmm. So it's a great question, Mayor. So if you have received the Pfizer vaccine, okay, if you have received the Pfizer vaccine more than 8 months ago, the second dose was given to you more than 8 months ago, get yourself the booster shot. The data for the booster shot in terms of number of people who have been administered is not currently released as yet in terms of the percentage of people who got the first 2 shots who got the booster. But the recommendation is pretty clear. If you got the Pfizer shot more than 8 months ago, get your booster shot. There's no ambiguity with the data around that. For Moderna, if you are immunosuppressed or if you have if you're in a high-risk age group or a high-risk category, go ahead and get your booster shot after 8 months. But if you're normal immunity or you don't have any high-risk exposure, you can wait for now, because the thing is with Pfizer, the dose that was administered within that vaccine was a slightly lower dose as compared to the Moderna. So the boosting effect of the immunity with the second dose did not last as long as what they found in this study. Now remember, these were done prospectively, so now as we learn more data, they change and adjust and things like that. But Pfizer is a perfectly good vaccine. It has a good safety profile. People have gotten it and not have any side effects. And I keep checking in on people who were vaccine hesitant. So a little bit of side note is we have mandated in accordance of New Jersey state law that all of our healthcare workers get the vaccination unless they have a religious or a medical exemption. And so this involved a lot of conversations with our staff. We talked, we explained all that we could. And we wanted to make sure that people understand that this is a New Jersey state law that all healthcare workers be vaccinated. I'm very, very proud to say that we have had about 94% of our staff either receive at least 1 dose. So 94% of our staff is fully vaccinated by the end of this month. And that's something commendable, because we are living in a society where everything is looked at a little bit more critically than it should. And we were able to get at least 94% of the staff to do that.
Right. I think that speaks volumes. That speaks volumes of people that really clearly gets it, understand the importance of keeping their family members safe, keeping themselves safe, their co-workers safe. And listen, we have given options to folks, right? We gave them an option of can't make people but either take the vaccination and or you come in every week and you get tested for COVID, right? So there's an option out there, but there's some institutions and some businesses who are not given that option, right? And because they know how serious it is. Either you're going to take the shots or you're not, or you have a certain amount of days. But I do want to go into, look, school started back, and during this COVID, our young people who are now going back into the schools, they are entrusting in the school system to do their part in keeping, especially parents, keeping their kids safe and healthy. Give me a take on, our young people going back to school full time, and how significant it is, or is this, is it going up? It's coming down. But two things. It's a twofold question. How significant it is for our young people to get the shot, and secondly, do you see a spike in young people, just say 18 and under, then from 15 down to 13 years old? What do those numbers look like?
So within New Jersey State, I can tell you for a fact that when we look at our people who are getting admitted to the hospital, let me start from people who get admitted to the hospital. What we have seen is a shift. When we started with the pandemic, we were seeing a little bit of an older age group of people, nursing home residents, people who had chronic issues, who were getting sick and getting admitted to the hospital. Now with this time around, with the Delta variant, exposure from a party, or they were out at a get-together or an evening barbecue and they got sick. They got really sick. And that has been spreading across the board in Jersey. Now, when you talk about kids, we have not seen an increase in COVID activity within the schools right now. When do we anticipate seeing it? We anticipate seeing it over the months of November and December. Why? Because that's when you start having your major holidays. Thanksgiving is going to be one big event that we are looking out for. Christmas is going to be the other one. So the month of November and December are going to be crucial to see how this pandemic behaves. And we have been on calls with the Department of Health, and we try to make sure we are proactive about it, we plan for it. Now with regards to the school system, the Pfizer vaccine has been approved for the age of basically 12 and above right now. They have completed the tests or the studies for the age groups of 5 to 12. We anticipate the data to be validated and evaluated, and hopefully we will have some more positive news with regards to the age groups by November and December. So that's when we will have more data if we can get the 5 to 12 age group vaccinated as well or not.
Right.
When we talk about schools, schools are a very congregated setting. Even though we want to think that kids are socially distant, wearing their masks properly, I can't get my adult people to do that. It's really difficult for the school teachers to expect them to manage the kids while making sure that all of them are wearing their masks. They're doing a Herculean job, and I really commend all the teachers who are pulling through this pandemic. I really do appreciate that. But that being one a spreader event. Most schools have instituted good policies around social distancing, routine testing of unvaccinated employees, screening of an outbreak. That real risk exists if you're not vaccinated.
Right.
If you're vaccinated, it stops, right? Like it doesn't spread as fast as it would spread if everyone was unvaccinated.
Right. And look, listen, I know for a fact, I hear it amongst my family, amongst my colleagues, I hear it among associates, that people are honestly just mass inundated, masked out. They just, they're tired of wearing a mask, but, it's for our protection, right? And listen, you probably, from your profession, answer this, but I'm going to ask the question anyway. Do you see an end to, this whole virus, this whole vaccination? Feel more safer in restaurants, and I'm in different stores, and those folks are wearing those masks. So I feel much, much better with that situation. But let me just ask, do you see an end, Dr. Mehta? You've been around from day one, more than day one. You know, when you start hearing about this, you really kind of, you and Dr. Griffin talk on how to shut these stores down. My question to you, do you see an end to this COVID? Do you see an end to the vaccination? Do you see an end to not wearing these masks? And look, and be honest with me, man, because I know some folks out there want to hear, man, is there ever going to be an end to this? You know, give us your perspective and your overview on where you at in terms of, you know, I'm going to say as a professional doctor and chief medical officer. Give us your perspective, man.
So I was actually looking up the flu estimates for last year. So do I think that there will be a life without masks? Yes. Do I think it's going to be 2022? No.
Okay.
Do I think it'll be beyond 2022? Yes. Okay. I do.
So,
think
Dr.
that
I'm about to put you on the spot. You said 20, not 22, not 23. Okay. All right.
Okay. And the reason for this is, remember, there are two parts to this. One is the official recommendations, and then the other is people's comfort, right? Like you said, there was, and again, I'm going to do a throwback, right? I remember the time when we were having one of these first ones, and you were like, you know, this is unnatural. You know, you see this on TV in all the Asian countries that people would wear masks, and you would be like, why are we wearing the masks? And then suddenly here we are in the USA, we are wearing the masks everywhere. And now we've reached a stage where you go into a restaurant and if nobody is wearing a mask, you're like, do I really want to eat here? Are they taking appropriate measures to make sure I'm protected? But that being said, every year we used to have, and again, we used to have just about 37 to 38,000 deaths due to flu. In 2020, that number is expected to be in the hundreds because everyone was wearing the masks. Think about it for a second. Going from 38 to 51,000 people who died every year from the flu, we came down to a few hundreds because everyone was wearing a mask. That piece of cloth protected people not just from COVID, but also from other viral diseases. And that's an important message. When people wash their hands properly, when people wear their masks, they don't cough on each other, they take the sick day when they are feeling under the weather, they don't come into work and spread their germs around, it helps protect lives. And that, I think, that message has been received very well. And people are more cognizant of it. People don't want to be in a congregated setting where everyone is on top of each other. Everyone wants to make sure that if you are sick, please don't come into the establishment. And I think that will go into. But the mask in its entirety will probably take some time for people's behaviors to change too. So I do anticipate that by next year we will have a much better idea of how this pandemic is behaving. And if more people in the country get vaccinated, we should be able to see a life without the mask, without the thought of booster shots. But I don't want to sell false hope. It all depends upon people getting vaccinated.
Right. So when you
know,
right. I'm sorry, Dr. Mehta. So look, we're looking at 1,111,758. Wow, that. Are you seeing a spike in different communities that are taking advantage of the vaccination and taking advantage of the booster that's coming out? And then when you look into the Africa, because you're here, you know, you're right here in the city of East Orange, right at East Orange General Hospital. So do you see a disparity of the African American community need to come out more, or compared to, you know, other white communities? You know, that's the only way I can put that. Right? Do you see a difference?
Yeah. Absolutely, and it's a great question. And you know, you can't address this question without talking about just general social issues that happen, right?
Right.
So amongst the African American or even the Caribbean American, I will put them under the black community, and I know it is not meant in a.
I should have used black and brown. You know.
Yeah. Generally speaking, no, and you know, it's funny because there is just a general mistrust of the establishment amongst the African American and the Caribbean American community. And there is a reason for that. There is a history behind that. That being said, there is also a deep preponderance of urban, socioeconomically deprived African American and Caribbean American community. And the religious declinations are what is going to harm us, because that is where people are missing faith and science together, and it's always a personal decision. And I am very much willing to step aside and listen to anyone who is willing to engage in a conversation with me about this. But when we talk about vaccination, I come not from a religious point of view, I come from a science point of view. As well, God did not want me. If God wanted me to get it, He would have inclined it. But somebody has to stop thinking that maybe this vaccine is the miracle that we were looking for, or is a miracle that would be the way you protect yourself from COVID. And we have to start thinking in that sense. Like, we think of it as just an object of science, but what is science but just miracles which can be explained, right? And we have to get the community leaders, whether it is the religious leaders and the pastors, to start talking about how to protect their congregation. We want the congregations to be protected. We want to make sure we reach a stage where everyone can come back into the church and do the Sunday worship. It is in my best interest to have the community come back together. If we can't get the community back together, how will we move forward? So that is one big aspect of it. The second thing people talk about is like things like custody, right? And I don't know if everyone knows Dr. Gloria Bozeman, but I really appreciate her a lot. She's the head of our local advisory board.
Yes.
And she said something which is very poignant. She said none of the people who are talking about custody were alive when custody happened. They have not been through it. Science has advanced significantly. Ethics have advanced significantly. West Orange, which is right across the border from East Orange, has about 100% vaccination rate, believe it or not, just about 100%. East Orange and Irvington, which is our area, are two of the 5 lowest vaccination zip codes in the state of New Jersey. Why is that discrepancy? What is it that West Orange people know that East Orange people are, or rather West Orange people don't know that East Orange people know about the vaccine that makes them not take it? And I'm like always looking at it from that perspective, because we want to make sure we address the concern. Saying that, oh, it's not for me, is not good enough anymore. The way the states are going about it, what they're going to do is start restricting areas that you can go into, whether it's restaurants, theaters, concerts, movies. We're going to start restricting those away. Because, I don't want to mix vaccinated people with unvaccinated. Somebody who is taking the responsibility for their own well-being should not be taken in with someone who wants to take their own life matters in their own hands. Do not pollute the environment in general. So that's where we will probably end up going in. That's what I think it is going to end up in. Again, it's a future thing, so we can
sit here this evening and have that discussion, because listen, we as a city, without a doubt, our health department, our public information office, my staff, we've been pushing, we've been bringing this message across the city with every event that we're at. We're out with our mobile truck out there, our mobile clinic, probably every day, Saturdays and Fridays, as I stated earlier, at different events. And we're hoping, and listen, it's really hard, right, when people are convinced that they're not going to take the shot. It's just hard, and as the mayor, my job is to encourage and continue to encourage, but I do find it a person's right when you can't force them. You can't force people to do something that they don't want to do, right? But I think that the general information that we provide and that we give out wherever we go, task. You know, it hasn't been an easy task. But listen, I think we just got to keep humping. We got to keep pushing. We got to keep getting out the information, keep providing information to our young people. Look, many of us witnessed so many of our friends and family members and co-workers and heard of people who have been affected, and some made it and some didn't make it, right? But those who the gate away from trying to get us at a level where we at, hopefully they give in. I think really, because I want to go into the cause, I think that when that Johnson & Johnson situation happened and people that were on that line and say, you know what, I'm about to go over the goal post, and I'm gonna go over the goal and I'm gonna do it. And a week before that, I think that sent people into a little uncomfort and in a discomfort zone where they said, see, because sometimes people just need one excuse not to do something. That one excuse where they was like, I'm almost there, I'm running the ball down the field, I'm almost at the goal line, I'm on a 5-yard goal line. The other day when my friend came by and said he took the Moderna, now I'm on a 4-yard. Soon you can make it to that 1 or 2 and cross that goal line, something came up. And that's just my own perspective of how, listen, we get there. But listen, Dr. Mehta, right? Right, listen, and I think that we just gotta keep driving it. I know how important it is in this community and other communities, but I can only speak as the commander-in-chief of this community. We're gonna do everything we can, but also I have to be generally always truthful that I do respect people.
To try and educate, get people over their fears. I can tell you for a personal fact that there are my employees who I was like, listen, I know you will want to get it, you're just afraid of like that, getting the 4th, the 5th. I mean, like you're right there, but you're hesitant till the last minute. And I was like, listen, I'll get somebody to walk with you, hold your hand while you're getting the vaccine. And there were people who got it because of that. They were like, you know what, I just need someone to take me there. And that was it. That was their thing that they were looking forward to. Like somebody who can make the quote-unquote decision, even though the decision was there, to help me make that decision. And that's where it was. We have to help each other get through it together. This is not something we can do in isolation.
Yeah.
And you are 100% right. Education is the only way. Engage in a conversation, because if you mandate it, people dig in their heels and they start becoming even more persistent with why they don't want to take it.
Yeah, you're right
We've
about
been trying really hard to get this communication. We have a Jersey state mandate for healthcare workers, so we just have to mandate it. And your only exemptions are medical, which is pretty much no medical reason to not get the vaccine. And then the other is religious, and which we are like trying to make sure we engage the pastors, because if the pastor gets engaged in that conversation and understands the point of view that we are coming from, maybe they will be able to educate the congregation.
Yes.
We have Reverend Dana Owens, who is a big supporter of the vaccination campaign. We want to make sure that we get that voice out there. We want to make sure we get any and every voice out there.
Yeah, we just gotta keep talking. We just gotta keep talking to each other, and those who have experienced the shot, regardless of which one they took, the Moderna or the Pfizer or the Johnson & Johnson, just tell the people your experience, and just see how we come out. But Dr. Mehta, what I want to do, because I'm always excited when we come back on our virtual town hall meeting to share with my community what's going on, what's been happening, what's in the horizon. We always up to that. So listen, what I want to do is take a few of the calls that did come through. I'm going to ask Connie to, let us go into some of the questions or issues or concerns that our folks who have been waiting so patiently on our on Facebook or on the telephone. So Connie, give me some questions, please.
Okay, well actually right now we just have 3 questions and they're all for Dr. Mehta.
All right, no problem.
So D. Walker wants to know, how long does the vaccination last? And so there's 3 different ones, so Dr. Mehta, if you can, how long each one is supposed to last?
So with the Pfizer vaccine, what they did this study, they found out that it definitely lasts up to 4 months. After that, the vaccine protection does decline, and it goes down by a few percentage points. So instead of being like 95% protective, it becomes like 75% protective, and so you need a booster to just get it back. A 4-month study. A 5-month mark when they did that study. The data is still coming out, so we don't have a recommendation either way about getting a booster shot if you got the J&J vaccine. But with Pfizer, that's why they came out with the guidance that, hey, if you got the Pfizer shot after 8 months, go ahead and get your booster.
Okay. Terry Leslie Miller would like to know, what's the difference between a booster and the regular vaccine shot?
So right now, the booster, so they haven't changed the type of the vaccine being administered, meaning that if the same vaccine that you got as the original shot is the vaccine that is continued into the booster shot. But Pfizer is looking at newer variants and seeing if they need to tinker with the vaccine formulation to make it more for the vaccine, the variants that are prevalent. But right now it's not vaccine dose, so you can, the one that you're getting at the first and the second dose is what you're getting at the third.
Okay. Glynis Curlew would like to know, is there somewhere someone can do vaccination at the same time?
So the recommendation is not to get both at the same time, and I would sincerely advise you not to do that. There has to be at least a 2-week break period between getting the flu shot or the COVID shot or any 2 shots in general. You want to keep a 2-week break period. The reason for that is, one, if you have side effects, you want to know which one did you get the side effects from, and what were the type of side effects. If you got an allergic reaction, you want to know whether it was the flu vaccine that gave you. Or the other thing is for your body to just be more reactive. It makes sense for you to take that 2-week break in between you get your 2 shots. So if you've got any vaccine today, you're not going to go and get your COVID vaccine tomorrow, and vice versa. If you got your COVID vaccine, you have to wait at least 2 weeks before you get any other vaccine.
And that's definitely good to know.
Yeah, that's very good to know.
We did get one more.
Yeah, we are in the middle of flu season. So if you are ready and talk to your doctors, please talk to your doctors. We are in the middle of flu season, and flu season is the same thing. We have to get your flu vaccine in as well this year.
Yeah, you know, it's funny that you mentioned that because as we went along, you know, last winter, folks started saying, man, why don't we hear about flu shots anymore? Why don't we hear about colds anymore? Everything was COVID, 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 you know. And it's good to hear that a little can get back to getting the flu shots, and there are those who, you know, really need it, especially our most vulnerable, and those are our seniors and those with underlying health issues, really need to go out and find the locations. And I know that y'all offer the flu shots also. We have one more question, Dr. Mehta. Go ahead, Connie.
Gwendolyn Garrison would like to know if you know when the Moderna booster will be available.
So right now, if you are immunosuppressed or immunocompromised due to medications or because of a disease or an autoimmune disease, company store in general, or make an appointment online and just schedule a vaccine dose and get your booster. If you are in a high-risk group, whether it's school teachers or in a congregate setting or a healthcare worker, they do recommend going ahead and getting a Moderna booster as well. But other than that, there is no recommendation for the general population to get a Moderna booster.
What about seniors 65 and up? No? For Moderna?
So it's interesting. The reason why I say it's interesting is because if you like you have an exposure or you are likely to get exposed based on your social or surrounding, I would encourage you, but there's no recommendation around it, honestly. So the recommendation does not exist for Moderna, but if you feel like you're in a high-risk congregated setting and you want to make sure you take that additional step to protect yourself, there is nothing that says no, but there's nothing that says yes either. There is no guidance released or recommendation released from Moderna at this time for seniors.
Thank you, Dr. Med. Dr. Med, there are questions coming in that people are concerned. One more question.
This question is from Carolyn Cornelius. She'd like to know at what point will it be necessary for everyone to get a booster? And will this vaccine be incorporated into the vaccines that all children receive in our public schools?
So we're talking future, and again, I'll give that disclaimer that whenever you talk about the future, you are bound to be wrong. Do I anticipate schools mandating it? Yes, absolutely. Why? Because schools will, once you get the full approval, not an EUA, you get the full approval, people will want to get the vaccination as part of the vaccine series. Right now, people who are opposed do not realize that almost have received vaccination in one way, shape, or form for whether you're traveling into the country, if you're an immigrant from outside, if you've traveled into the United States, you've gotten vaccinated. If your kid is in college or school, they've received their shots. When the kids are born, they are given vaccine shots at the onset as well. Vaccines are way of life, and so once they are approved, schools will make sure that they put it out there. Right now, you already see it in some of the colleges. They have mandated vaccination. I think Rutgers is one of them, where they have mandated the vaccination for all students who are returning back to school. There is going to be some opposition, but overarchingly, if you want to go to a good school, if you want to go to a good college, if you want to get a great living, it is a part of life. Absolutely. But again, like with everything future related, I am bound to be wrong. So I don't say 100. I'm not going to be a gambler and bet 100% of my money on it. But my good best guess scenario is that yes, it's going to be mandated soon across the board.
Right, and look, let me think.
Sorry,
go ahead, Dr. Mehta.
Just once to complete that statement, especially if we go into another month, another year, where COVID continues to scourge through the country, we absolutely can.
Yeah, people are, traveling. People are, although we're in October, people are starting to plan around, the holiday season and then, Christmas and Kwanzaa. So we as we come back on these shows, we're gonna remind people to still stay very vigilant when it comes to, just protecting themselves. So what I want to do, Dr. Mehta, I just want to go through just a few of our updates and some of the things that we are doing around the city. And I'm listen, this is our first week back on. We took a small summer pause. That's all we did. We never closed the book to what our responsibility is and always going to be to the 65,000 residents of the city of East Orange. And this conversation tonight to me was really a kickoff to a start of many more Wednesday town hall meetings. But what I want to do, I just want to give a few updates to the folks who are joining us tonight. And I tell you, I appreciate all of you. I miss all of you from just coming on and having these conversations. I hope those who have joined us are doing well. And we want to be of any help. This city want to be of any help or any importance that our residents have, our constituents, and those who are with us here in the city of East Orange. We want them to know that we are still here doing what we need to do to keep this city moving. So let me just bring up a few things. I mean, we have so much going on while we continue to stay safe. Those who have any questions or concerns about our property maintenance department, feel free to call. We was out today. We was back, mayor on the block, our quality of life walk throughout the city. We was joined by our different department heads out there. We haven't stopped, but we just paused and made sure we do it in the right way and a safe way. And when those folks come up to us, we got our masks on and they got their masks on. But we had a great walk today in the 2nd Ward, mayor on the block. We also was joined by our councilman, Councilman Alway, who joined. Keeping our city clean. Talk to your neighbor who's next door to you who sometimes don't clean up their property and you do clean up your property. But I do want to give kudos to all those individuals, all of you out there. If nobody said it, I thank you so much for taking the initiative, taking the pride in your property. Those store owners who take pride of going in front of their store from the time they open, midday to the time they close. I give you, but we need everybody to do that. We're not just one person or two people doing this what we should be doing. It's our civic responsibility to our community. So we're driving this cleanup, right? And we want you to join us on Saturday, October the 16th, right? We're gonna start right in front of City Hall. We're a partner with Castro, Keeping America Beautiful, and Los Angeles Rams. So if you Rams and the Giants. So again, on October the 16th, we're going to be in front of City Hall. We're going to be champion. And we asking everyone in the city, even if you don't come out, we want to see you in front of your store. We want to see you in front of your house. We want to see you outside your apartment building. If there's a lot where you can clean and do it safe, we want nothing to happen to anybody. But we're asking the entire community. Those who come out on Facebook and always, you should come out because you're the ones who don't come out. You're the ones that sit on Facebook and criticize us, right? Those who want to be a part of our community, come on out on the 16th. And we all, look, I hate to say this, guys who always come out and help us keep our community clean. That's all we're asking of you. And then the next day, the Rams and the Giants play at a local game, I assume. So we're taking on all volunteers. If you're a volunteer and you're in this community, you want to help us keep this community clean, come on out. We welcome you. We do. You know, we constantly say one goal, that goal is progress. Be a part of the progress. Be a part of the progress, good people. You know, don't talk about it, be about it. Also, we got several other events going on around the city. We got flag raisings. We'll be posting the flag raisings up, which is the Pan American flag raising on October the 8th between 4 p.m. and 8 p.m. right in front of City Hall. That's our Hispanic Heritage celebration. Also on October the 9th at Hare Park between 1 and 4 p.m. Also join us for our Faith and Blue Community Picnic. We're still having picnics. See, we're still outdoors enjoying our community. And that's October the 9th at STEM Academy between 12 p.m. and 4 p.m. hosted by our very own men and women of our police force and our faith-based. Now also, Mommies on 2S Motorcycle Club is hosting a family fun day at Elmwood Park, right? And that's on the October 9th too. So there's a lot going on around the city. So come on out on October the 9th between 2 p.m. and 5 p.m. They're going to have live music, food, fun, and that's going to be at Elmwood Park. It's open to the public, right? And let's always talk about our recreation department very quickly. Site. Go on our Facebook page, right? I don't see nothing going on. No, you don't see it because you don't go on our Facebook page. You don't see it because you don't come to council meetings. You don't see it because you're not trying to find the information that we provide, right? And guess what? Even yourself as a person who lives in this community and invest in this community, and you got any ideas that'll help us move our city forward, come share your ideas. We welcome you, right? I'm feeling good tonight, so I got to get that off. So again, we still got basketball, we got volleyball, we got bowling, we got swimming, we got track, we even got Zumba, you know. Come get some Zumba, you know. Or you just talked about, she got the hip hop. We're going to get her in to do some hip hop. So we got a lot of things for our young people. We're going to embark on and intrude on adults to get involved. We're going to bring these programs to our city at a low cost and to the people of the community. So listen, everyone, we also just want to give those folks a shout out, our Fifth Ward Council members. They got a meeting at the community meeting. Zoom is on Zoom. Again, we continue to make sure that we bring information to all of you on Zoom. So for information, call the council's office at 973-266-5120. 5120. But you can call the mayor's office also at 151, right? So with that, I gave you a lot of information. Listen, if you look around the city, we just had a groundbreaking over on Walnut Street with moderate and affordable apartments. I'm gonna say that again because again, we hear folks always saying that we are pushing. The city is diverse, right? And we're driving a city where people want to live here, want to dine here, want to raise their families here, and we want people to be able to grow here, right? And the only way we're going to do that is that we got to make sure that these blighted lots that y'all see, because y'all talking about us building, redevelopment in the city, right? We're trying to get these vacant lots that you have been walking it by and our young people have been walking it by for many days. We're trying to get these lots up, right? And we're trying to do redevelopment. I have to say this, right? Because those who constantly come on Facebook and make those remarks, come talk to us. Come talk to our policy planning and development department and find out if you got ideas and you want to share your ideas with us that you think will work in a city that you live in, then come and join in on a conversation and tell us what your ideas are, what your thoughts are. And you know what? A lot of times, if they are where direction that we're going with this city, then let's see if they work. But come and be a part of what we're doing. Also, we encouraging first-time home buying in the city of East Orange. We're encouraging our young people and those folks who are willing to go through the 3 seminars, but please call the Office of Policy Planning and Development for that information. But again, if you ever get stuck on a number or department, just call the mayor's office of Control. I'm going to end with that. I'm going to ask Dr. Mehta to close out with a statement or close out with something that he thinks that would just give us the energy. The next week we come on. Dr. Mehta, so I'm going to bring you back on. We had a great town hall meeting tonight. It was our first time back in a few months, but we're excited. So I'm going to ask you to close out, Dr. Mehta, with anything you want to close out with, and then we're going to close out our program for tonight and stay on track with the time.
Thank you so much. And Mayor, again, thank you. From a perspective of just the hospital, we have the vaccines. We have J&J vaccine. We have started giving the shots within the ER. So if you ever want to get the shot and you're not sure, we're offering it to everyone. So please come into the ER. We'll give you the J&J shot, or if you want a Moderna shot, you can just schedule the appointment online. if you need any sort of services, we are more than happy to take care of you. We really want you to take advantage of the hospital. But that being said, Mayor, again, thank you. It is great to be back. It really is, to have everyone ask questions, get out there in front of people, let them know what is happening. And again, to your point, there are people who will always criticize. And like you said, come and engage in the conversation. It's okay to criticize, but come and engage in the conversation.
Yeah.
So I think that's what we need more of, more conversations and less conflict, because conversation can solve all conflicts. Yeah.
Right, and we thank you. So, Dr. Mehta, thank you so much. I thank my staff. We have Tony Jackson here, we have Connie here, we have Precious here, we have Audrey here, we have our IT department here. We're grateful for everybody that partake in what we do when it comes to these virtual town hall meetings. I just want to leave our community with this, right? We are moving this city forward. We ask all of you to be a part of our vision, our mission, because you're here, right? And I just ask all of you, because you can't be on the sideline telling us what to do, what we shouldn't do, what we're not doing. I'm asking y'all to get in the game, and let's play this together in the city of East Orange and move this city. I thank all of you for joining us tonight. I thank you for allowing us just to always partner on things